Do you like to exercise, but chest tightness, coughing, or wheezing happens when you do exercise? If your answer is yes to any of these symptoms, you may have one, exercise induced asthma, or two, exercise induced bronchoconstriction. What's the difference between the two? Well, exercise induced asthma happens to people already with a diagnosis of asthma. These people have asthma at baseline and experience symptoms with exercise. On the other hand, exercise induced bronchoconstriction happens to people without asthma. They only have symptoms associated with exercise. This commonly occurs in athletes. Whether you have exercise induced asthma or exercise induced bronchoconstriction, the symptoms are all the same and occur within 5 to 20 minutes after exercise. These symptoms are wheezing, chest tightness, cough, shortness of breath, and rarely chest pain. Your next question might be, why does this happen? The airways in your lungs get very narrow with increase in airflow during vigorous exercise. See an allergist immunologist like me for diagnosis and maybe a breathing test. Treatment plans could include inhalers like albuterol. Now, the recommendation is to use the albuterol 2 puffs 15 minutes to 30 minutes before exercise or oral tablets like Montelukast. The other name for Montelukast is Singulair, and you want to take it 2 hours before exercise. Non medication recommendations are 1. Warm up for 10 to 15 minutes. 2. While exercising, breathe through your nose. 3. Cool down for 10 to 15 minutes. And while you're cooling down, try jogging and stretching to avoid rapid warm to cold transition. And 4. Begin hydration, like water, about an hour before the activity and throughout. This allergy tip is brought to you by myself, Dr. Garen Wolff, Chief Allergy Immunology Physician of Wolff Allergy and Asthma.